All right, go ahead.
Okay. Hello, everyone, and welcome to the Family Caregiver Support Program weekly training and education session. Today, I will be discussing fall prevention and safety. My name is Jasmine Morales, and I am a case manager for the FCSP program. Okay. And then before moving on, I would like to introduce the FCSP team. So we have Michelle McGuire, which is our program manager, and Olga Yamawaki, which is our other case manager. Okay. Okay, so again, I'll be discussing fall prevention and safety. So next. And next, okay. And a quick overview of what I'll be discussing today. So today's topics is on fall facts, talking with your doctor, physical activity, home and community, and what you can do to prevent a fall and to help a loved one. Okay, so some fall facts, according to the Centers for Disease Control and Prevention, so also known as the CDC, falls are the leading cause of fatal and non-fatal injuries. So now I want to take a quick pause and mention that this statistic does not take into account what we call a near miss. So what is a near miss? So a near miss is basically when an older adult trips but catches himself, so it does not lead to a complete fall and is therefore not reported. But it is a sign that a fall could happen in the future. So we want to take near misses very seriously. And moving forward, 1 in 4 older adults fall annually. 1 out of 5 falls cause serious injury. So this is hip fractures and so forth. Every 11 seconds, a senior is treated in the ER for a fall. So as you can see, it's important. Every 19 minutes, an older adult dies from a fall. And I want to share a quick story of someone that I know of. So this individual went traveling to a different country, and she actually fell but didn't think it was serious. She just got a couple scratches on her elbow. She slightly hit her head and didn't think much of it. She got dizzy, and she went on with her trip, came back to the US. Thankfully, she had a doctor's appointment. But within that doctor's appointment, as you know, they were talking about the trip and so forth, it came out that she had an intracranial hematoma. So has she not, spoken to her doctor, talked about her trip, the doctor would have been unaware of this. And, this could have led to further complications if it was not treated then. So again, I'll be discussing on what topics to discuss with your doctors. And as you can see, the importance of fall prevention. Okay. So falls among older adults is a serious issue, but many falls are preventable. And there are things you can do to help reduce your falls. Okay, so next. Okay. And here on this slideshow, I just want to show the trend in the number of falls. Unfortunately, you can see that it has increased from 2007 to 2016, and most likely has increased now in 2021. So 7 fall deaths every hour by 2030 if we don't take precautions. Okay, next. Okay, so there are many different things that can increase the risk of falling. These include past falls, hazards in the home and community, problems walking, balance problems, weaknesses, improper footwear, chronic conditions, diseases, depending on which one it is, multiple medications. So taking multiple medications can also be a risk factor. Poor vision, depression, memory problems, and behaviors like rushing. So you'll see that some of these risks have to do with inside the body, and such as balance problems and chronic diseases. However, there's also other risks that include outside the body, which is hazards in the home or improper footwear, as mentioned. Okay, next. Okay. So because there are many different factors that contribute to falls, there are different recommendations for reducing a fall. So I'm going to focus on three main things. The first one is talking with your doctor. So this can be either for yourself or the person you're caring for. And you want to talk to your doctor to identify and treat medical problems that might lead to a fall. This can include discussing previous falls with your doctor, reviewing your medications, and getting your vision checked. Second is getting your regular physical activity. So making a plan to have regular physical activity, either in a class or in your home. And thirdly is home and community. So being aware of safety hazards in your home, community, identifying fall hazards, and making those changes for safety, which is also called home modification. And we'll discuss further along on how to stay safe outdoors. Okay, next. Okay, so first, I'm going to go over some things to discuss with your doctor. Next. So your doctor can help you learn about personal fall risks. Some examples of chronic conditions include diabetes, arthritis, and high or low blood pressure. Also, muscle weaknesses. So that includes difficulty standing up from a chair, the toilet, or getting out of bed, either for yourself or for a loved one that you're caring for. Your doctor can also conduct a fall risk assessment to identify personal needs, personal fall risks, and make recommendations on how to reduce them. Okay. So now medication. So we take medication for many different reasons, to lower blood pressure, relieve pain, help us sleep. So it's very important to bring all of those medications to your doctor visit. And this includes vitamins. Not many people think that, you know, it's important for your doctor to know what kind of vitamins that you're taking. So taking your vitamins, any herbal remedies, if you're taking any herbal remedies, over-the-counter drugs, because it can change, and, you know, there could be side effects with other medications that are prescribed from your doctor, other medications that you're taking. You also want to mention if you have dizziness or unsteadiness after taking a medication. And again, this is either for yourself or for the person that you're caring for. And you also want to be aware of over-the-counter cold and flu medications. You know, some side effects are drowsiness, dizziness, lightheadedness, changes in your blood pressure. Again, it all depends on what you're dealing with. So your doctor would be the person to talk to. Okay, next. Now your vision. Although sometimes it feels like, you know, or it could feel that our vision doesn't change much, it is very important to have your vision checked every year by an eye doctor. If you don't have an eye doctor, ask your doctor for a referral. They can refer you to an optometrist. There are some eye conditions that are more common among older adults that can cause vision loss, such as cataracts, retinopathy, glaucoma, and age-related macular degeneration. So as you can see in the picture, cataracts, which is right at the top, you can see that the area is a bit clouding on the lens of the eye, so that causes blurred vision. Sensitivity to bright light and glare can be an issue for people who have cataracts, and they can have difficulty seeing at night. Now, in regards to diabetic retinopathy, which is right on the right side, so that is damage to the eye's retina that occurs with long-term diabetes, causing blurred vision or shadows and eventually leading to blindness if the diabetes is not controlled, unfortunately. Glaucoma at the bottom is a group of eye conditions that damage the optic nerve. And then last but not least is age-related macular degeneration, which slowly destroys sharp central vision, making it difficult to see fine details. Okay, next. Now, another thing is caring for your feet. It's important. It's an important part of fall prevention. So any injuries or other foot problems that may cause pain, numbness in your feet is something you should discuss with your doctors, as it can increase the risk of falling. Next. Assistive devices. So if you have problems walking or keeping your balance, ask your doctor if an assistive device would be appropriate for you. Some examples include wheelchairs, walkers, canes, and motorized scooters. Those are some examples. So there's a lot of inventions out there. So especially if you buy something from the store, definitely talk to your doctor again to see if it's appropriate. Now, I know an issue with assistive devices can be that, there is some loss of independence. However, the way I like to see things, or the way I like to, tell others the way to see things is, is it going to help you at the end of the day? Does it really care what people say about you? I've had, previous from my experience, I've had people decorate their canes and say, hey, this is my BMW. I'm going to park it right here. So there's different ways to, to see it. It's changing your perspective. Is this device going to help me? Yes. Is my doctor recommending it? Yes. Okay, next. Okay, so now I'm going to discuss physical activity. So some types of physical activity include exercise, whether this is outdoors, indoors, daily activities, going to the market if you're walking there to the market, hobbies, and meditation, yoga. Okay, so being physically active on a regular basis is an important part of fall prevention. Physical activity is anything that gets you moving. This includes exercises such as community or fitness center classes and so forth. Now, physical activity that helps reduce falls, the most effective, are those that improve your balance, strength, flexibility, endurance. So there's different kinds. In regards to lower body strength, some squats, and of course they can be motorized. Again, talking to your doctor to see what activities best fit your condition. Everyone's different. Tai Chi, that can improve balance. Okay, next. Now we're going to take a look at how to stay safe at home and in the community. Next. Okay. So it's important to look at the different areas in your home for fall hazards and make changes to increase safety. You can do this yourself with a home safety checklist. A home safety checklist is available at the Los Angeles County Department of Public Health website. So you can get one from there, or you can talk to your primary care physician, get a referral to get a professional home safety evaluation at your home. This can be done by having a nurse visit your home or an occupational therapist. Once you identify these fall hazards, the next step is to make these changes for safety. Okay, next. Now, making changes for safety. It can be simple and inexpensive, such as keeping your pathways and walkways clear by rearranging furniture and moving clutter if that's an issue. Light your way. So, for example, putting a lamp in an easy to reach place by the bed or using night light to make the path between your bedroom and bathroom clear. A night lamp, keeping frequently used items close to you. Want to keep that beside your bed, your medication, your water before going to sleep. Next. Now we're going to see some common fall risks that can be found in the home and ways to reduce them. So the picture on the left with the red frame shows a hazard, and the picture on the right with the green frame is it shows a change for safety. So on the left, we can see a worn out bath mat with a frayed edge that could easily come in between you and a fall. You can easily slip and trip with, the stuff sticking out by the door. So, you want to remove those throw rugs or scattered mats and secure them with some floor grippers, as you can see on the right, or get some sort of different product base on your flooring. These can be purchased at your local home improvement store or at a garden store. Next. Adding support in the bathroom. So many falls happen in the bathroom where wet floors can cause slips. So the picture on the left, you can see the soap dish and towel rack. They're not designed to support a person's body weight and should not be used as grab bars. So, that can be easily confused. Grab bars should be securely placed in locations that would best support you and not force you to get into an awkward position. Like the gentleman on the left side, as you can see, he's holding on to two things, which is the towel rack. And then the picture on the right shows a more supportive shower area. It has the grab bars in the tub next to the toilet. Considering putting a non-slip mat can also be another suggestion. Next. Staying safe on the stairs if you have stairs. So on the picture on the left, you can see there's a little bit of clutter there. So making it clear, sometimes when, the phone is ringing, we're rushing to get the phone call and we have all of this in our way, that can easily cause a fall. So we want to keep our pathway nice and clear. Next. Sometimes the things that we do can increase the risk of falling as well. And this includes carrying things while walking, not paying attention while walking, climbing on unsteady stools. You know, hey, let me grab this chair from the table and let me get that pot from the top, you know. Reaching far down to get something in the cabinet. So if you're carrying something, watch what you're doing. Have someone, you know, if you do have someone in your home, watch you or be right by you. Caregivers, if the care receiver is very well independent, sharing these suggestions would be helpful. Okay, next. Staying safe outdoors, whether you're walking to stay active, traveling, going to the store, a fall could happen outdoors. So you want to watch out for uneven sidewalks or any fallen leaves, especially when it's windy or stormy weather. Sometimes the uneven sidewalks are marked with red paint. Many are not, so we want to keep an eye out for that. Wearing footwear with firm soles and low heels. And remember, taking your time. You know, hurrying across the street may put you at risk. So give yourself some time. Okay, next. Okay. Staying safe around your pets. So we want to keep pet items out of the walkways. Something that can be useful is putting a bell so that you know where, you know, your dog or cat is at. You can hear them. Walking your dog in a well-lit area if you take your dog out for walks. Using 2 hands on the leash when you're walking your dog versus 1 hand. Okay, next. Okay, so what you can do, another option is getting a personal emergency response system, carrying a phone with you in case you do fall. You have someone to call or call 911. Create a check-in system with loved ones. Tell your doctor if you do fall, you know, write it down. Where did you fall? How you fell, what you were doing, how you were feeling. Because at the moment, you know, as previously mentioned, the example, you know, you may not think that it's something serious, but it could be something on the inside of your body. So we always just want to make sure everything's good. Okay. And then every fall is different. So, you know, it is difficult to give recommendations, but in general, if you do fall, remember to prepare, check, rise, and sit. So prepare, take a deep breath, relax, look around you, check to see if you're injured, rise if you feel like you can get up, roll over on your side, then slowly get up on your hands and knees and crawl to the nearest chair or any sturdy piece. And then put your hands on the chair seat or that sturdy piece. Get up on the knee that is the strongest. Sit for a few minutes before doing anything else and call loved one. Okay, another thing is getting up in the morning. You know, sometimes we get up quick, get out of bed. Blood circulation isn't all there. So we want to take also a couple seconds before we get out of bed. Okay, next. Okay. And here are some resources, some fall prevention resources that could provide information and links to fall prevention services. Next. And lastly, I just want to thank everyone for joining and for watching. this education video on fall prevention and safety. Next, and we're going to open up for questions. Anyone has any questions, suggestions, anything they would like to share, additional tips?
I was wondering, Jasmine, the slide you showed about the increase in the instances of falls, is there any theories about why there's such an increase?
Well, one is our population is growing, baby boomers. So that is one. Two are also not taking the necessary precautions.
Yeah, you brought good points, and I like the way you brought up a lot of this falls, or I think you called it at the beginning of your slide, that are not reported. You know, minor, you don't think of anything. It was just, you know, I almost fell.
Near misses.
Right. So
Yeah.
it's good that you brought it up, because, you know, those near misses, one day it's going to lead to a fall.
Mm-hmm.
So
yeah, I was going to ask you, I think you mentioned there's no way of knowing how many, but I mean, is there any kind of estimate of how many near misses there are? Because there's got to be at least one near miss for every fall, right? I mean, you would think, because it's kind of a progressive, if it's somebody's balance or somebody's strength or something that is associated with their body, and, you know, and they're chronically ill, if we're talking about caregiver support program here and our clients and their care recipients. And that's something else I was thinking of too. When you were going through the slides, it's like I was thinking of clients, but then I was also thinking of caregivers. I mean, this is just as relevant, you know, because anybody can be a fall risk.
Yeah. And it's not just with older adults. It can happen to myself. It happens to kids. Kids fall often. It's just the necessary precautions that you take.
Yeah, I think kids fall constantly, right? They're just a little more resilient. Yeah, that's an excellent point. You know, the only problem with the falling is the damage that it does to our bodies. Yeah.
Definitely.
Is there anything, do you know if there's anything online that people can access, like a little checklist for their own home where they can do a little quick assessment if they can't get a professional one?
Yeah, so I believe I mentioned it on my
resources.
PowerPoint. Yeah.
Which you don't have access to right now, do you? Or maybe you
do not.
I believe AARP has one.
Mm-hmm.
Okay.
We have one. It's not that detailed, but it'll give you the gist of it.
The basics. Is that on our website?
It's in our resources folder. We should have it up
internally.
Right.
Okay, yeah, let's try to get that up on the website, definitely.
Yeah.
And then I just want to read over the resources, Jasmine, that you had on your slide, just so people can know. We had the Center for Disease Control, or the CDC. You had the Administration for Community Living, also known as the ACL, the National Council on Aging, the NCOA, and the LA County Department of Public Health. So any of those websites would probably have information and checklists on falls.
Yeah, definitely the Los Angeles County Department of Public Health. They should have that checklist there.
This is great. This has been a wonderful overview, a lot of detailed information. I hope that going forward, you know, that you'll do more of these presentations on falls, because I just saw so many areas and topics that you can expand on.
And yeah, definitely. And sometimes it, you know, for those who have already fallen, you know, that they're scared to fall again, or there's individuals that don't want to use the assistive devices. So how do we get them to use them? How can we change their perspective? A lot of it is, you know, loss of independence.
Yeah.
What are my friends going to say? What is a neighbor going to say?
Yeah. Or maybe being able to help them find something else. Like maybe they don't need a cane if they just do some leg strengthening.
Mm-hmm.
And that's a very simplistic thing to say. And I know that, but I mean, maybe there are other ways to help people that they haven't thought of. Yeah.
Or what kind of exercises can I do? There's modifications where you can do them sitting down on a chair, resistant bands.
Yeah, chair yoga.
Mm-hmm. Mm-hmm.
I've seen some really great chair yoga classes. Yeah. Well, thank you. I'm going to go ahead and stop the recording then.